Assalamu alaikum. I'm Dr. Jalal. Today, I have very important topic for discussion and presentation, that is pregnancy and vitamin D supplementation. So, why this topic is important and why I selected this topic is the reason behind it is I frequently get the prescriptions of vitamin D supplementation from gynecologists or general medicine or family medicine people. They often give a very high dose of vitamin D in pregnancy, which is sometimes harmful for the fetus. So I see prescription where they are prescribing 6 lakhs international unit IM for the pregnant lady. So that is not acceptable because vitamin D has teratogenic effect if it is administered in higher dose. So keeping this in mind, I had made the presentation to simplify the vitamin D deficiency in pregnancy and the supplementation of vitamin D in pregnancy. So we'll move on to the next slide. So here is the old story. We all learned about it. That is, if if hen is laying golden egg, so whether we should get a daily one egg in a natural way or try to extract all the eggs in the one day. So obviously, daily one natural egg in the natural way is what we expect to collect. So the same way vitamin D when we are giving, it should resemble the natural supplementation or natural dose of the vitamin D rather than giving the bolus dose altogether in a pregnant patient. So, regarding sunlight, sunlight is the major source of vitamin D because once UV radiation enters into the body, it converts the inactive form of vitamin D and activate it. So, we need to have 30 minutes of exposure involving face, upper and lower limb. But for in between 10 a.m. to 3 p.m. This time is very important because most of the people at this time either they are in the office or they are at home, so they are less likely to expose to the vitamin D producing UV radius, which is between 10 a.m. to 3 p.m. And sunscreen, if we apply with a sun protecting factor of 8 or more, it won't allow vitamin D producing UV rays to penetrate the skin. So it's as if we are in dark rather than in exposed to the sunlight. And glass windows, when the uh, sunlight passes through the glass, it won't UV radiation won't pass. So if UV rays won't pass, then there is no synthesis of vitamin D in the body. So this slide is very important to know the importance of sunlight, time of the exposure to the sunlight, and duration of the sunlight. And what are the things which blocks the entry of the sunlight into the skin. So what are the sources? So we have natural sources of vitamin D. Out of this, cod liver oil is the best source, where 1 teaspoon contain around 1300 international unit of vitamin D. One thing to concentrate here is milk and egg. Milk and egg, though they contain vitamin D, but in very less amount. So taking milk and egg as a source of vitamin D is a poor choice. So they contain calcium, but no very minimum vitamin D. So we have myth, or we have belief that milk and egg contain vitamin D. We need to change this myth. They have calcium but no vitamin D. Vitamin D either present in the sunlight with UV radiation, which converts the activate the vitamin D in the body, or secondly either cod liver oil, which is very good source of vitamin D. So what is the daily requirement of the vitamin D? So we need to give supplementation of vitamin D in addition to the normal daily requirement of the female patient. So daily requirement of non-pregnant female is between 18 to 50 years is 600 international unit of vitamin D. So if they get pregnant, then they need some additional dose in addition to 600 international unit. So if patient is female, a pregnant female, so we classify into three groups. One is standard pregnant woman with no vitamin D deficiency. The other is high risk women who is likely to develop vitamin D deficiency. This group include obese, dark skin, and patient who are on steroid, patient who are taking statins or post gastrectomy, gastric sleeve surgery like this. Then the pregnant woman with with approved vitamin D deficiency. These are the three groups we get in your practice where patient may have the problem related to vitamin D. So why vitamin D deficiency is problematic in female? Because it affects on pregnant mother and the developing fetus. A mother likely to land up in preeclampsia. There is increase of incidence of LSCS and impaired glucose tolerance in the mother, whereas it causes low birth weight, hypocalcemia, and poor skeletal growth in the fetus. So if patient is having no vitamin D deficiency, we need to give 600 international unit, which is the normal requirement of the female of that age group. Plus, we need to add 400 international unit extra, considering the pregnancy. So total will be 1000 international unit per day. If the patient is high risk of developing vitamin D deficiency, you need to give 600 as a daily requirement and add 1000 international unit. Total constitutes 1600 international unit of daily. If patient is having proven vitamin D deficiency, then they need to be given 3000 international unit per day. This need to be given till 10 weeks, followed by 1000 or 1600 international unit, depending on the subgroup of the patient, whether they are having normal lifestyle or having high risk, belongs to high risk group. So one thing which I want to stress here is the acceptable supplementation of vitamin D is 4000 unit per day. More than that may cause teratogenic effect, that is subvalvular stenosis in developing fetus. So the thing point need to be remembered here is supplementation of vitamin D need to be more similar to physiological synthesis in the body. Administration of daily low doses is more preferable rather than monthly or weekly dose. So take home message after this presentation is vitamin D. The timing of sunlight exposure is 10 a.m. to 4 p.m. Vitamin D normal daily need is 600, and depending on the type of this group in the pregnancy, it may we need to add the 400 unit, or we need to add 1000 unit, or we need to give 3000 unit per day. And big no to bolus therapy. There is no role of giving 60,000 unit oral supplementation or 6 lakhs international unit injection. More than benefit, they are harmful to the developing fetus. So thank you. I conclude my talk for today. Thank you.